Good afternoon, everybody. My name is Anthony Bruce, and I chair health industries for PwC in the UK, and I'm absolutely delighted to be chairing this podcast this afternoon and this fantastic conversation with some esteemed colleagues that I'll come to shortly. This is a Next in Health LinkedIn Live series, which we are using really to engage in pertinent issues in healthcare across the UK, which was obviously an important sectoral issue and societal issue. In this episode, we're discussing how the public and private healthcare sectors can harness the power of technology and data, and are harnessing that to really transform the future of healthcare, to deliver the best patient outcomes in a fair and equitable way. I'm really delighted to be joined by another fantastic panel of guests today to explore this topic with us. Firstly, I'd introduce Pritesh Mistry, a policy fellow for digital technologies at the King's Fund. Charlotte Williams, Chief Strategy and Improvement Officer at Mid and South Essex NHS Foundation Trust.
Hello.
And Jude Simpson, an expert in our health team who's worked with a number of public and private sector organisations around the healthcare issue, really focusing on digital strategy and products. So delighted to have all of you here, and really good to spend the next 30 minutes with you. So just setting the scene then as we get into this, before we go into exploring the particular topics, I'd really rather just sort of a step back on why this is important, and why is it important that both providers and for providers and patients, and frankly government, that technology is a critical part of future service provision. So maybe coming to you first, Charlotte, perhaps I could ask you that sort of, why are we having this conversation, and why is technology important?
Thanks very much. I mean, I think there's an inevitability about the fact that technology plays a part in the modern world, and in how we now function in society. So I think it's unavoidable that we're going to need to consider the implications of technology in any complex human system, which is what delivery of healthcare is every day. And what do we mean by technology in this context? I think what we're talking about is the use of digital systems and devices to aid communication, planning and support decision making. And those are essential to healthcare, both in terms of as a health provider, as an individual professional, and also as a patient or someone looking after someone with a health need. So I think it's got a lot of facility to facilitate those things, because those are central functions within healthcare. And as someone who works in the NHS every day, my whole life is filling gaps, workforce gaps, financial gaps, gaps in knowledge, gaps in expectation. So I think the best place to think about technology really is how it addresses some of those shortfalls, but it sits within the humans. It's a combination of how the humans interact with the technology to make that happen. So I think the main one for me really is around the opportunity to improve reliability and safety. The first thing we need to do is to provide safe healthcare, and we see lots of examples of how digital can do that through the consistency of use of devices and information, and increasing accessibility, so kind of equity and accessibility of healthcare, so how it can improve the reach to patients and populations. We've seen that through virtual care, through telecare, through greater empowerment of patients with participation in their own treatment and planning. So I think it's important because it's essential to how we all live and behave now. And we need to be accommodating that in a personalised healthcare service.
Excellent. Yeah, thank you. And we'll come back. I think that people point is really well made, and we'll come back to that sort of skills and people point. Pritesh, I guess coming to you, where are we now in terms of organisations having those tough decisions to make in terms of both the cost, availability and cost of technology, but it being an absolutely, as Charlotte says, an absolutely critical part and an integral part of the way service is transformed. I guess some reflections from you around that topic would be great.
Yeah, thank you. So building on Charlotte's input. I think, asking why, it's a very important question, but I think also we're not framing it correctly, to be honest, anymore. I think what we should be asking is what happens if we don't digitalize and transform. As Charlotte rightly mentions, there's gaps everywhere, and the pressures in the health and care systems globally are substantial. There are some that are unique to the NHS, but many are shared as populations age, non-communicable diseases become more burdensome. I think we're all familiar with the story and what's the forecast and the pressures on healthcare systems. But again, as Charlotte mentions, with only finite numbers of staff, time, money, there's tough decisions that need to be made on the best way they can use all of these. So the care that can be provided, the care that is needed can be provided, staff are supported, and the system can be improved so we continue to build towards the future. And that's a key challenge. It's squaring that circle. It's a real challenge. It's essential for staff to be involved in transformation, but that means they're likely to be less available for delivering services during that period of time. And so pragmatism, phasing are key, and leadership are key here. And so I think one of the core things that we often avoid talking about or don't recognize is that standing still is an illusion. So science and technology progress, more things become possible. Right now it's around digital technologies and genomics. And so it's not necessarily about whether not to digitalize, it's the fact that standing still is actually falling behind. And the question for me that I constantly have in the back of my head is, how do we start moving towards getting the highest value of innovation from increasingly more science and technology?
Yeah, excellent. So maybe more why not than why. Yeah, great point. You mentioned innovation, and maybe coming to you, Jude. Clearly a challenge for organisations to make the right choices, to with the proliferation of providers, of technologies, of applications to support some of the things that Charlotte talked about and Pritesh talked about. I guess very broad question, but Jude, what are some of the key technologies that we're seeing implemented and that are already making a difference in healthcare?
Yeah, it's a really big question. I think the slightly trite answer is to say there isn't really anywhere that isn't been touched by digital change at the moment. But I'm going to try and categorize it a little bit. And I suppose, firstly, a lot of money at the moment is going into what I term foundational technology. So by that, I mean, what do you need to deliver safe care at scale? How do you share records? How do you get your data in order? And you obviously need this in place to do the more complex, maybe more interesting things that can fundamentally start to make a difference, like electronic bed management. And that's something where we've seen where it's been done really well. It can drive real change within organizations. And then you've got a whole bucket of technologies that enable kind of truly personalized patient-centric care. And there I'm thinking about things like the NHS app and patient portals and different novel ways of accessing care, particularly in primary care, that in some areas are really starting to change the relationship between citizens and clinicians. And once you've got both those foundations in place, you can start to do things where people will really start to feel the difference, like implementing population health solutions, providing care closer to home. Then you've got advances in back office, and that's so important if we're going to keep the NHS as a sustainable organisation, including things like RPA, advanced analytics, generative AI, and so on. And here, I think the real value comes from what I think both Pritesh and Charlotte have already touched on, which is humans and technology working really closely together. And finally, you've got the sexy, exciting stuff that really captures the public imagination, which often I think point solutions around a specific challenge, which might include things like robotics, it might include precision medicine, and it might include some of the really exciting use cases we're seeing around, for instance, for use of extended reality for dementia patients and patients with Parkinson's, for instance.
Right. Interesting. Yeah, and a very broad landscape, and I guess we're seeing a lot of pilots and a lot of single point use cases, some of which you talked about. But I guess thinking two things: where are they getting delivered at scale? Because that's where we achieve the biggest impact on patients, frankly, and the system. And how do we think about patients in this? So technology in and of itself isn't the answer. We actually have to make sure that this is delivering for the system and ultimately for patients. I guess maybe coming to you around that that patient-centered view, how are you seeing, or where are you seeing things adopted by patients, and what are some of the challenges and opportunities in that area that you see, Pritesh?
So I think as Jude mentioned, there's a lot of different technologies, so it depends on how you're kind of dividing them up. So many of the technologies, I suppose we tend to focus on patient-facing technologies first, and that adds more complications into the system. Patient portals are particularly beneficial for people having more access to their, having more control over their health access and services. Access to medical records through the NHS app is particularly important, especially as we move towards more of a mobile-first kind of technology. Some of the things that I've started to write more about is how we start building systems collaboratively. So how we think about digital infrastructure beyond devices and connectivity, so hardware and software, and start thinking about how we build and design services within communities for people, with people, to have inclusive services that are addressing people's needs, that have the right content within them, the right functionality within them, to ensure that, as Charlotte mentioned, we get more inclusive services overall when we bring digital alongside traditional services.
Yeah, great. Thank you. And Charlotte, you're in the front line, as it were. What seeing patients in your trust, how are you seeing the impact on both the workforce and how we bring them along on this journey? Because clearly they're under a lot of pressure. They have a lot of other challenges and priorities that they're trying to manage. What are your thoughts? Your thoughts on that?
Yeah, I think listening to what Jude and Pritesh have said, I think my view is that the route to scaling is every member of the NHS workforce. The biggest innovation opportunity or adoption opportunity for new technologies is the people who use them every day having a role in making and designing them. So I think digital systems are cited as a main issue in our staff experience, for good and for bad. In pretty much any survey that you see, pretty much our pulse surveys we get regularly, it's the frustration, it's the missed opportunity, it's the why can I do this in this sector or this part of my life and not at work. So I don't think we need to get buy-in to the idea of technology as being part of. We've already kind of rehearsed that in this conversation. I think it's about the fact that people feel that they have the power to change their daily lives through that, and that it's going to add value. I think we talk about technology as being enabling the release of greater time to care. I think that has been seen to be possible. I think places with a high digital maturity, they are finding that they can substitute tasks. They can reduce the burden on staff. I think that's still quite a big leap for people to appreciate, given at the moment the threshold to get over to implement a lot of technologies is very high. And we know that even from electronic patient records, that the personal commitment to education and understanding in order to be able to benefit from those systems is considerable. So I think we've got to recognise as leaders in the health service that has to be properly built up in terms of capability and capacity within the NHS workforce, and that also we give people tools to be able to do some of this stuff locally. So how can we use like low code, no code? How can we support people to use the systems we already buy to get better value out of them in the context where they are? And we believe in my organisation in allowing a lot of flowers to bloom in terms of ideas for improvement and innovation, because actually most of them probably require quite standard technologies to bring about. And we can allow there to be that local nuance that's needed. And we've seen that in tools that staff have co-produced and developed that support what they do in their own care settings. So our Maternity Direct application allows midwives to speak to women. That's where the real value comes, I think, where we get the workforce to engage in technology as an opportunity rather than just as a set of products that, as Pritesh says, just kind of complicate the landscape for them even more.
Yeah, I think great. Oh,
if I could just come in there, Anne. So I think that's a really interesting point, and just kind of leaping off a point Jude made about foundational technologies. So two aspects. I think there's an absolute need to reduce variation in the system. So if we're going to have scalable technology, it needs to have standards behind it. It needs to have as least variability as possible, so it can be as close to plug and play as possible, as kind of Charlotte mentioned, then you can start using no code and stuff on top of it. I think there also needs to be a recognition that there is significant investment in particular parts of the system to digitalize. Whereas if we look at, say, social care records, that's still very, very early stage. Community services are highly fragmented in terms of digitalization. If you look at some of the early stage research on AI in ophthalmology, for example, there's huge potential, but the foundation isn't really being built at all in reality. And then there's the cultural deficit side of it. So yes, staff can be really, really empowered by technology, but I was having a conversation with a group of district nurses a couple of weeks ago, and they were telling me their laptops don't last all day, they're too heavy, they can't charge them in the car because of various different health and safety requirements, they don't have Wi-Fi, and so then they're duplicating input across two systems. So there is this cultural deficit aspect of things that we need to get the basics working well. And so we can get people enthused as well about the technology rather than just having to put up with it.
Yeah,
I think that's so true, Pritesh. And I know, having had very similar conversations with district nurses, and I remember a woman saying to me, I can't do technology, I don't do technology. And when we kind of dug into that a little bit more, you know, she used an iPhone, she emailed, she banked on her phone, she did her shopping online, she spoke to her kids on FaceTime and so on and so forth. What she meant was she couldn't use the tech that was provided by her trust because the user interface was rubbish. And the impact of that was that she felt like she wasn't good at her job. And I'm sure she was a fantastic nurse. I'm sure she was really good at the caring aspect of it, but the technology and the technology available because of the UX was de-skilling her. I think that's really tragic. I think, you know, in terms of how we empower the workforce, it's not just about empowering them through upskilling, which is incredibly important. It's also about providing them with tools that are as good as possible, as close to as possible, the ones that they use in their personal lives.
Yeah, I think great points, and in that, I think putting people at the heart of this is absolutely critical. I think I also heard technology in context of your day and your job, and I think it was a point that you made, Charlotte, around it's not all about new, it's actually about using what we've got. It's not just chasing the next thing. I think it's actually about, as you're saying, we have made investments, the NHS have, and the private sector has made investments in technologies. It's making sure we're getting the best value out of those. I'm going to move us on, if I may, around the patient. We've been talking about the sort of the provision side. Clearly huge demand on the service, and that's impacting, we've heard, around workforce, but also patients. What are some of the opportunities to bring together the power of technology and data to understand patient need and demand? I know, Pritesh, this is a bit of a puzzle and a conundrum to solve, but what's the basis of some of the technologies that we need to, and/or infrastructure that we need to be putting in place to address that? Come to you, Pritesh.
Thanks, Anne. It's a very important question, I think. So data can obviously help to identify where and how patients are accessing needing services, how effective those services are. I think it's important to remember the data is a window on the world, but there's often nuance in real life that isn't visible through this window. So data is a starting point, creating metrics from there, but testing and validating hypotheses and iterating with people is very important. I think there's also something about thinking differently about healthcare. There's so much more technology can do to help patients and the public to be more confident, more in control of their health and well-being. There is something that we don't really talk much about the power dynamics and how we're moving from a system where we've obviously had a lot of clinical expertise because that's where the knowledge has traditionally been. But now with technology being able to give patients access to their medical records and information and knowledge online, there's so much more people can do. And so technology can then bridge the gap between clinical expertise and patients' capability. And so I think there's a question around how technology makes finite healthcare resources more scalable through simple online information or through AI or through remote and asynchronous systems. So it's that kind of scalability of resources and from a finite perspective. And then there's a question of what tech can do better than people, and how we continuously improve along the metrics that matter to patients, carers and staff. So for me, there's those different aspects that we need to start bringing to bear.
And on that sort of, what can technology do better than humans? Any thoughts on or examples that are going through your mind around
that? Interestingly, I was at a robotic assisted surgery event not so long ago, and so the enthusiasm was amazing and absolutely incredible to see some of the data coming through on what that potentially enables us to do in terms of clinical safety, in terms of working environment for staff, in terms of reduced bed stay days, in terms of economic impact, in fact, so people recover quicker and get into work quicker. So that is, I'd say, it's not an automation of a surgeon, but it is very much an assistive tool that helps to dramatically change what's possible in terms of interventions, and also the implications for injury in terms of people's bodies and recovery time as well.
Excellent, thank you. I guess, Charlotte, picking up on some of the what you're seeing in your day-to-day work in the NHS, some of the complex challenge of and how we can better use data to inform service provision, patient engagement, and frankly also the workforce. I mean, reflections from you following Pritesh's comments.
Yeah, I mean, it's really interesting listening to that, and actually I was just thinking about the community nursing example that was referenced earlier on, and I think part of me, it makes me very sad to hear that about, I can't use this, I've been given this tool and it's making my life worse rather than better, because somebody somewhere made a really well-intentioned decision to invest there and with the right outcome in mind, and we've just missed some steps, and I think that erodes the trust that we need to have in technology and in the data that it facilitates. And I think part of this is about how do we step up to have the kind of responsibility and public stewardship around kind of digital and data in the way that we do around data in its broader sense, in terms of data security and clinical confidentiality and things like that. I think we haven't quite landed that in the NHS as yet, and I think that if that leaks out through our staff and their lack of confidence in digital, then that's going to leak into our relationships with patients as well. And we draw attention quite often to things like information sharing. The NHS is littered with various attempts to communicate with the public about why data sharing is important, but actually it's normally an assumption that we do that every day in the delivery of connected care, and it's quite a surprise sometimes that we don't have access to that information. A personal experience of my mother passing through a care pathway, my father had no idea why organisations all had the same lozenge, weren't all one organisation, and that that's obviously the lived experience most of the time. So I think trust is very important, and I think certainly generationally, we're becoming more aware about the ownership of data, and that it's a sort of commodity that needs to be protected and used. And I think also within the NHS, in developing technology, we had quite traditional approaches to working with industry, for example, very risk averse, very culturally distant, and very protective. And I think what we're seeing is certainly the work that I do with entrepreneurs and working with sort of to co-produce solutions better. And we're doing much more now of working with a number of different industry partners that provide different parts of expertise, like our work perhaps to modernise outpatients, not one pathway. Nothing in health is a linear pathway, it's a complex system. So thinking about how you can have a different relationship with technology providers, data organisations, storage organisations, all of these sorts of things to provide solutions. The NHS kind of has to trust that those partners will work together and that service can be provided. And I think the thing about accessibility to all, I think, is a really interesting one, because sort of make the assumption that people aren't excluded now, and that if we introduce something digital or a new piece of technology, we're going to exclude people. But we know that's not true. So I like to think about how we apply a test that isn't, how do we do an impact assessment about avoiding exclusion, to be more about what's the impact assessment, you know, to improve the kind of inclusion, if you see what I mean, to build it in as a positive trait in what we're trying to do, and how it's going to reduce the burden on the people with the healthcare problem, who we often ask to do more work because of technology or because of data requirements more than anything else. So I think, you know, thinking about how we design for maximum inclusion, you know, even thinking about things like a letter that has a picture on it is easier for everyone to understand, not just people who may have a low reading age. And trying to think about that openness and transparency about involving people in the design of data is the way to build that trust. And trying to involve, as I said before, our workforce in the design of technology will build their confidence in giving that third confidence in their care interactions with patients to come on that journey with us.
Excellent. And yeah, love those points. And also I think the need to embrace and scale more innovative commercial models between providers. The NHS has such a fantastic set of data, and obviously, you know, patient data and so forth. And I know there's a lot of thinking going on around innovative commercial models and frankly business models. So yeah, no, great point.Maybe to you, Jude, just briefly, we're coming up to time. You know, reflections on the sort of tech-savvy patients coming through. We've got obviously a multi-generational question here. Just a few reflections before we move to close in the next few minutes.
Yeah, so if we don't reflect the expectations of an increasingly tech-savvy population, we're not able to harness the points that Pritesh made around efficiency and so on. I genuinely think there's something quite existential for the NHS here. And what I mean by that is that if we take as our starting point the NHS, that care in the NHS should be as much of a comprehensive service as possible, free at the point of use, accessible to all, we're going to start seeing people opting out if they can't access NHS care in a way that's appropriate to the modern world, and as new providers come in with disruptive models. And I suppose it's up for debate how much of a problem that is. And personally, I think there are lots of reasons why we should be cherishing that concept of comprehensive free at the point of use care. But if we're going to allow that fundamental principle to be really challenged, then it should be done by democratic consensus, not because the NHS isn't, that those expectations aren't being met, or because the NHS is being inadvertently disrupted. So I think we have to believe this is possible. And for me, this has been a really exciting conversation in terms of hearing what's happening within trusts and out there already in terms of making this a reality. Great point.
Yeah, clearly an ending on a positive here. We've got a couple of minutes. We've heard today around some really practical ways that technology is being used, and also the sort of not why not, but maybe why can't we? You know, use some of the more innovative technologies. And I think, to Charlotte's point, that requires new business models and may require new commercial models. But maybe just coming to each of you in turn, a really rich discussion, and thank you. But one takeaway action briefly or reflection from today. So maybe you first, Pritesh.
Thanks, Anne. I suppose in reflection, really exciting to hear about everything that's possible, but I think what we need to do is ensure that we keep an eye towards the future while stepping slowly or as quickly as possible, but not forgetting that we need to do the foundational stuff first, while we aspire to use the shiny, exciting stuff in the future as well.
Excellent point. Charlotte?
I suppose for me, it is all exciting. It's limitless potential, but technology won't achieve anything unless the people who deliver the care are there to do it and know how to use it and feel the benefit of that. And I think there's a huge opportunity here to engage and excite and bring back, reconnect some of our staff to why they do what they do, using technology and data to empower them. And I think we should focus on building that more into our work in the future.
Excellent. And I'm going to move to close now to hit time. Look, thank you to our external guests. A real privilege to have the conversation with you today, to Jude, Pritesh and Charlotte. And to those listening now and the recording, look, we hope you enjoyed this. Please look out for future episodes of our Next in Health series on LinkedIn. And again, thank you so much to our panel and our listeners for joining us today. Many thanks.